important and which we teach when we are practicing the chest positions.
So another question that one of our attendees has put forth, what to do if the person starts responding? So I will come to
Yeah, so if the patient starts responding, that means you've given good effective CPR, and what we say as return spontaneous circulation has occurred. Now, if this is an out of hospital cardiac arrest, yes, we will observe this patient. If it's not a trauma patient, we like to keep them in a lateral position or a side position, and and we wait for the ambulance to come, take the patient to the hospital, and we keep monitoring the patient that the patient is still responsive and has not gone back into cardiac arrest. So you can give a pat on the back to yourself that you have rescued this patient. But we need to stay with the patient till we get the ambulance and medical help to take to the higher center.
Thank you. I will ask Dr. Shah, sir, what about the breathing? People say that along with CPR, you should do breathing.
I agree. I think way back, 20 years back, even for layperson, we were teaching not only chest compression, but we were teaching breathing also. That's why specifically we have renamed it as compression only CPR, because giving breathing requires a lot of expertise. Sometimes it takes around 3 to 5 minutes to give an effective breath, and it can lead to gastric insufficiency and regurgitation. And there are certain reserves of oxygen in the body which sustain for certain time. Number one. Number two, when we do a chest compression of 120 times, some amount of oxygen come in and out. So that sustains the oxygen for some time. Also, the oxygen requirement goes down when the patient gets in cardiac arrest. So considering all those aspects internationally for last many years, the breathing is not taught to the lay person. However, the moment the trained personnel arrives, which includes paramedics, nurses and doctors, they do give breathing, but they use special equipments. For all common people, layperson, we suggest do high quality chest compression and do not attempt to give breathing unless you are trained for.
So I will talk to Reena ma'am regarding the role of Red Cross, because I hear a whole kinds of training and how Red Cross is working.
It addresses, like you were saying, that mostly these kinds of incidents happen in areas like where bystanders are there, can become the first responders. So it seems like Red Cross has a two-pronged approach. Like it has got the St. John ambulance, which does the proper certification, and CPR is an integral part of the first aid certificate. And like students, teachers, drivers, industry workers, and whoever wishes to take that certification, they can get that certification. Nice. Ministry of Road Transport and Highways and Labour Departments. So many of the professionals also get this certification for their work-related requirements. Then we have CBDR, community-based service reduction projects, where also these first aid training is an integral part. It's a part of the curricula. So the communities which are most vulnerable to disasters, they are trained in all of these while trained. Gap that Indian Red Cross is trying to address by training the volunteers, training the communities, and also having the certification program in the St. John ambulance. This is the way. So anyone who wishes to can,
That's nice. That's helpful. I'll ask that if there is a case of a rib fracture during the CPR that was asked by one of our attendees, so any of the panelists that will be comfortable to answer that.
Sir, if there is a rib fracture while doing a CPR, see, rib fracture can be taken care of. If we are doing it in a CPR in a right way, there should not be a rib fracture. But yet, if there is an incidence of rib fracture, I think the CPR should continue.
Like to add, if the fracture has occurred, it has occurred because you're not doing it properly, and most importantly, it is more towards, it's not your compressions are not towards the center of the chest, but have gone towards either side of the chest, because of which you have compressed. So one is continue with compressions, two is check why it has occurred, so that you do not repeat it. Maybe only one that has fractured, but if you continue doing it in the same manner as you were doing earlier, you would cause further harm. So these are the two things you have to take care of. Continue with it, and later on, whenever the rescue team arrives, they will manage the patient accordingly. The rib fracture to take care.
So they need to reposition their hand.
That's why
So another question that was asked was what are the drugs that can be used during the CPR?
For a layperson, no drugs are recommended. And what we are talking about, hands-only CPR, that is for laypersons, and that is being done in field. If anything is cardiac arrest occurs in hospital, then there is a proper protocol. Then, as Dr. Rakesh has already mentioned, that oxygenation becomes a very, very important part. So that also needs to be taken care of, and then there is a protocol of giving various drugs, IV drugs need to be given, and in what manner, what dosages, all needs to be followed. So if you are out of hospital, do not think about drugs, just continue with the compression as effectively as possible with the things that have already been covered earlier. So that message needs to go, do not worry about drugs at all at this stage while you are doing cardiac.
But do try and get an AED if it is available. Like if you're in a public place, like the government has put up AEDs in the malls and the metros and the airports, try and ask if we have an AED, and that should be used along with chest compressions as soon as possible.
Thank you. So this was really very engaging because really we got wonderful questions from all the attendees. I will take this situation to have a live demonstration if one of the experts can come and live demonstration. So that would be helpful before we come to the end of this discussion. So, thank you.
Some kind of question. What is in respect of areas?
Okay, so, just to revise it all with everybody, we just take a situation or a scenario in which a person has collapsed in a mall. So what are you going to do? The first and foremost, हमें देखना है कि we are हमारा scene safe है, our scene is absolutely safe. After that, what we will do is हम क्या करेंगे? We will check for responsiveness and breathing. So we will tap on the shoulder and shout, भाई साहब, कैसे हैं आप?
रमेश,
So then you will check कि उनका कोई response है, कोई eyes कर रहे हैं, कोई movement है कि नहीं, और वो breathe कर रहे हैं कि नहीं, chest eyes और what कर रहा है कि नहीं. Now this is not happening. So now this is an urgent situation. Now what do? I have to act quick and I have to act fast. So first of all, I am going to make a call. Otherwise, I'm in a mall. There are so many people. I can call somebody. I can just request somebody to please make a call to 112 and ask for an ambulance with me and explain where I am exactly.